On your health tonight, hot weather, itchy skin. A lot of kids develop a rash or two during the summer. How can you tell if it's serious? Here to talk about that with us is Dr. Kristen Moffat, an infectious disease specialist at Boston Children's Hospital. I just said to Ed, we saw you in the monitor. I said, where has she been? We miss you.
Long time no see. It's great to see you, Doc. Great seeing you. So, all right.
It's good to see you too.
Let's start with the heat rash. What is it, and why does it affect mostly younger children and infants?
Yeah, heat rash, or it's sometimes also called prickly heat. This happens when pores or sweat glands have gotten blocked, usually because they're rubbing against fabric or clothing, and then they become inflamed. And the reason that it's more often seen in infants and young children is for a couple of reasons. They're more likely to be overdressed in the heat, and they also have more skin folds in areas like the neck and the armpits, and those are areas where heat rash is most likely to develop.
Yeah.
But the good news is it's very easy to treat just by cooling down. So that's the most important treatment for heat
good.
rash.
Just cooling down. Very good. Yeah.
What other skin rashes do you expect to see more often this summer?
Yeah, there are a number of things that we see more in the summer, just mostly associated with spending more time outdoors. These might include mosquito and tick bites, both of which can be avoided by using careful insect repellents or wearing kind of long, light, loose layers of clothing. The other would include poison oak or poison ivy, which can be avoided by not playing in areas where there's like overgrowth or brush, or if there has been skin exposure, really washing affected skin or clothes really well with soap and water is important. And then there are a handful of viruses that are more likely to be transmitted during hot, humid weather and that can cause rashes. And those include viruses that could cause molluscum contagiosum, which can be kind of a bumpy rash, or the viruses that can cause hand, foot, and mouth disease, as many parents have heard of that too. Yeah.
You know, Dr. Moffat, I always find it a difficult conflict because if it's 100 degrees out, you don't want to wear long sleeves and long pants. It's
Right.
too much.
Right.
But it can be helpful. All right. So do doctors typically have to see the rash in person to know what exactly it is and how to treat it?
I would say that seeing the rash can certainly be helpful. So I would recommend that parents take a picture of the rash, the areas that's most affected, because they might be able to share that with their pediatrician's office, even if they don't go in for a visit. But again, most of these rashes are not anything serious. So giving a call to your pediatrician's office is always a good start. The questions that will be asked are going to be really focused on trying to see whether or not this is one of those more serious rashes that might require more urgent evaluation and treatment. So the questions are going to focus on things like, are there any other associated symptoms like fever or a change in behavior? The questions might focus on how much of the body is involved in the rash. Is it near the eyes? How old is the affected patient? Because infants might be a bit more susceptible to some things. So be prepared for those questions. And I think having available photos is always helpful.
All right, Dr. Moffat, always great to see you. Thank you. Stay well.
Take care, Dr. Moffat.